Good morning, everyone. At the beginning, I'd like to thank the organizing committee for giving us the chance to present our journey in establishing a men's health society and the lessons we learned. I have nothing to disclose. When we go back to the history of men's health, we notice that men's health groups and clubs are existing for the last 50 years. However, they are associated with urological societies around the world. This has been the case till the development of the American Society of Men's Health in 2012, followed by the International Society of Men's Health in 2013. The question is, why do we need a multidisciplinary society to take care of men's health? First, men are known to have shorter life expectancy and a higher mortality than women. In addition, men are indulged in high-risk behaviors like smoking, alcoholism, and violence. And generally speaking, men are less attentive to their needs than women. As a result, the International Society of Men's Health defined men's health to include four important components. First, male gender-specific diseases, like prostate diseases and erectile dysfunction. Non-gender specific diseases, like metabolic syndrome and bladder dysfunction, in addition to behaviors that are more common in men and impose health risks like smoking, abuse, and violence. Lastly, the social situation that involve mainly men, like armies, construction, mining, shipping, and their related health effects. Since then, many societies were developed around the world, in both developing and developed countries. Over the last 4 decades, we recognized a significant change in health trends in Saudi Arabia. We noticed increase in the life expectancy from 64 years in 1980s to 74 in 2000s. And Saudi Arabia is a male-predominant society, where 57% of our population are male. The last census shows that the total Saudi population are around 32 million. Half of the population are between the age of 25 and 54 years. Obesity is affecting 1/3 of the population, and diabetes is affecting around 1/4 of the population. Of those diabetic men, 86% has some degree of erectile dysfunction. As a result, we launched the Saudi Society of Men's Health in 2018, and since then, our members' educational activity public awareness campaign has been tripled and quadrupled. I will go through the lessons that we learned from that short success journey. First, Saudi Arabia is undergoing a major transformation since the launch of the Saudi Vision 2030 in 2016. We tried to align the society mission and vision with the national vision and strategy. One of the goals of the Saudi vision is to increase the life expectancy of citizens to 80 years by 2030. Our duty at the Saudi Society of Men's Health is to actively promote, encourage, and support the highest standards of clinical practice, scientific research, medical ethics related to the study, diagnosis, and treatment of men's health conditions and concerns. By doing this, we were able to sign one of the important agreements with the Ministry of Health in Saudi Arabia to run educational activities directed to the general health practitioners to promote men's health. The second lesson is to try to involve more stakeholders before official launching. Don't make it a surprise to the other scientific associations and stakeholders. Try to avoid any resistance from others. By doing this, you will avoid conflict of interest, be able to deliver your task, spread the word, be recognized nationally and internationally by the industry and the organizing bodies, and finally accomplish your target. Third lesson. Funding is a major issue, and funding burden can be controlled by collaboration with supporting partners. We started with one strategic partner, and now we have 12 supporting success partners. We were able to raise $125,000 in 2019 that was spent on 49 activities, including public campaigns, educational courses, and awareness journals. The fourth lesson. Work hard in being affiliated with other national and international societies. That can be in the form of discounted membership, access to educational material, sharing social responsibility that will help to be recognized nationally as well as internationally. The fifth lesson. Involve national and international figures in the field of men's health in your educational activity. That will help your society to be recognized internationally. The sixth lesson. We are at the time of social media and social media advertisement. Use of social media platform to advertise your mission and activity. We uploaded a total of 33 videos in our YouTube channel. Much more of public as well as professional messages in our Twitter accounts. So please follow us and subscribe to our channel. Our website is currently under development, but hopefully by the end of this year it will be available for professional as well as the public in both languages. Seventh lesson. Men's Health Society is not a urology discipline. It involves other health specialties and other allied health professionals. More than 1/4 of our members are non-MDs, and around 1/3 of our MD members are not urologists, including cardiologists, endocrinologists, family physicians, as well as internists. Hopefully this percentage is going to grow in the future. The eighth lesson. Let the public believe in your mission. This is the major goal of such society. This can be through awareness events and material. We started the Men's Health Month, published and distributed men's health magazines, booklets, brochures to the public. In conclusion, each country has its own social culture, health habits, and its unique environmental factors that can influence men's health. National societies are more useful and productive in delivering its benefits to men than international society. Preparation and learning from others is the key to success. If you may allow me to end with the words of Henry Ford, coming together is a beginning, staying together is a progress, and working together is a success. Thank you very much.